Oh my goodness, I am so excited for today's episode. I have not one, but two guests with me today, and they are both undergraduate SLP majors looking to go on into graduate school. I found them, or they found me on a Facebook site, and they started asking questions. And I said, hey, why don't you guys come on and we'll ask these questions on the podcast, and we'll record it, and we'll put it out there for the rest of the world. And we agree, they all agreed, we've all agreed. So this will be great. You're going to be hearing from Miss Jordan and Miss Abby. Hello and welcome to the Missing Link for SLPs podcast. I'm glad you're here. Remember what it was like back in graduate school, or maybe you still are in grad school. Today's episode is part of the CSD Graduate Students Journey series. In this series, I talk to students who are either in school or fresh into their clinical fellowship year. We talk and cover real subjects like how to get into graduate school, how to find and prepare for a medical internship, thoughts on teletherapy from a student's perspective, and lots more. Get ready for some real conversations with SLP students who are at the very beginning of their careers. We are back. Here we are with Jordan and Abby. Hi, guys. Thanks for coming on.
Thanks for having us.
This is going to be fun today. Before we start, there is going to be for our listeners a little bit of a learning curve because there's three of us on this Zoom call, and we're going to be trying not to bump into each other as we talk. So welcome, and I'm glad you're here. You guys are undergraduates. Tell me about where you are and what you're studying and where you want to go.
I can go first. So my name is Jordan. I go to TCU. Me and Abby both, we go to TCU. And I'm studying speech language pathology. And I love this field, and I kind of got into it because I've always wanted to help people who have disabilities or are unable to function as people who it just comes naturally for. And then communication is such an essential thing to life. And so I kind of got into speech pathology because I want to help those who can't be able to have access to that normal communication. And I hope to go to grad school still at TCU. And I want to definitely work when I become an SLP, work as a pediatric SLP, and maybe in the medical field.
Wonderful. Where is TCU and what does TCU stand for?
TCU's Texas Christian University, and it's in Fort Worth, Texas.
And it's snowing there right now for you guys.
Yes, it's snowing.
Yes. Jordan, you said you're up at 3 a.m. playing out in the snow. So.
Oh, yes. Me and my friends got up and we were so happy, like big kids, making snow angels and everything.
Wonderful. Abby, tell us about your journey, your path.
Yes, so I'm Abby, and I'm from Fort Worth, Texas, and I go to school at TCU, like Jordan said, and I'm a junior in my undergrad in my spring semester there. And I became an SLP because I had this amazing experience with this little girl. I worked at a summer camp out here in Texas, and so I was working with this little girl, and she had Down syndrome. And so she was recently adopted from out of the country, and so she had almost no language. And I got to spend the entire week just loving on her and getting to see so many milestones of her, and just being able to almost not teach her language, but to see like different sounds coming out and just like working with her on sign language. And that was just an incredible opportunity, just to see what it was like to love someone so much and just be able to help them in something that seemed almost so important, just like a necessary skill that you would think everyone would have, just to be able to communicate. And she didn't really have that. And so just for me to come alongside her and just to be able to be a part of her story was absolutely incredible and life-changing. And I realized that I wanted to do that for everyone else. And her mom was actually a speech pathologist. And so I decided that I wanted to study that too, and just to be able to help her and other people like her. And I would love to work with kids in the future, maybe adults. I'm kind of learning more about that field and that world too. And I also really love working with kids with autism. So that's an area of study that I'm really interested in and I have a lot of experience in. And I would love to go to University of Texas at Dallas for grad school.
And that sounds exciting. That's one of the things that I love about our field is the many, many things we can do and where we can go and who we can work with. It's really neat. I often hear from graduate students that they don't know where they want to go or what they want to do yet. And my words of advice there are don't limit yourself early on. Just really open your eyes and be open to whatever your instructors are teaching you and look for those opportunities to learn where a speech pathologist can shine. Well, thanks for sharing those stories. They're always fun to hear.
Yeah.
So you guys have some questions, and we're going to talk about those questions today.
Yes, we have some general questions and then questions about what it's like to work in private practice and what it's like to work in the medical scene. I guess we can start with our general questions. Abby, if you wanted to start.
Sure. We just kind of wanted to know what exactly that they're teaching you in grad school. Like specifically, do they teach you about different job opportunities out there? And then do you need to kind of like choose your grad school based on like what profession that you want to do and like what they're going to teach you, if that makes sense?
Yes, that's a very good question. When you move into a graduate program, you're moving into an accredited program by the American Speech Language Hearing Association. So all your graduate program, if it's an accredited program, will be following ASHA guidelines and standards on what they need to teach you as you move out into the field to become, to get your Cs. So you will be learning all about ASHA's Big Nine. Do you guys know about ASHA's Big Nine?
No.
I think so.
ASHA's Big Nine? Oh. Quiz, spontaneous quiz for me. ASHA's, they're the 9 areas that a speech pathologist and an audiologist can treat. So if you go on to ASHA's website, there's ASHA's Big Nine, and I've got a really neat downloadable that I can put with the show notes here. It's a really neat visual of the 9 areas that a speech language pathologist or an audiologist will treat. It includes language, voice, speech, pragmatics, social language, fluency, dysphagia, and hearing. It covers all of those different areas. So when you move into a graduate program, you're going to find that your coursework is very, very focused on the ASHA's Big Nine. You're going to be learning about how to understand, how to assess, and how to treat any one of those areas. So by the time you graduate from graduate school, you're going to know a lot about a lot. As you move forward into your careers, you're not going to have to know everything about ASHA's Big Nine. For example, working in a medical setting, I don't work with fluency, so I don't use the fluency that I don't have to keep those skills up and current because it's not something I treat. Good graduate programs will teach you about job opportunities. You want to find a program with graduate professors who have interest in your area of study. So Abby, I know you mentioned autism. When you interview for your graduate schools, one of the questions you may want to ask the graduate panel that is interviewing you is, tell us about your interests and your areas of research or passions in our field, because you want a professor who's really going to be alive for what you are alive for. And I do a lot of voice work, and I have a lot of students in my graduate program come and say, tell us about the voice. So you want to find a program that has teachers who are passionate about the areas that you're in as well.
Okay. Very cool.
Awesome. I have a question kind of going off of that. So if I am interested, and because I know, Abby, you said your main area of what you want to focus on is autism. I'm not too far off. I want to focus on neurodevelopmental disorders in general. So do you think that when looking for a grad program, I should look for something that encompasses there is like a research lab that encompasses all types of these neurodevelopmental disorders, or do you think it's better to look for something that's more specific, like autism or Down syndrome?
You're going to want a good program that is going to give you a wide base in everything.
Okay.
And then as you go through because you're going to be responsible, every program, accredited program is going to be following ASHA standards for an accredited program. We all have to meet those standards. So on that basis, every graduate program is going to have those bits and pieces. The additional parts that you're talking about are going to be cultivated by a professor or somebody that's their interest. For example, I interviewed Dr. Katie Strong. She's from Central Michigan University. And she's very big into aphasia. And she has, my story lab, or my strong story lab. She was in a previous episode. And so the students who are really interested in the aphasia may search her graduate program out because they know that she's going to have this program for them, or like the labs that you're looking at. So you're going to get a base foundation of everything. And then as you work your way through your graduate school, those extra opportunities that you have available to you are going to be what really advances your specific area of skill. So
Okay.
then when you go on and do you start building your resume, you should be starting to build your resume now with these volunteer opportunities, Abby, like you said at the camp. And these are things that are, in addition to your graduate program, are really going to set you up for when you roll out of your graduate program into your career. You'll have so much more experience.
I can ask the next question. So what advice would you give your undergrad self, knowing what you know now as an SLP?
I would say be open to anything and everything that comes along, and don't think you might not like something, but be open to learning and exploring those options. And off of that first question that you asked, I don't think that grad programs talk tons and tons and tons about job opportunities and things like that. I think you're going to find that out in the Facebook community, out in, like, we sit, I'm the Future Professionals Committee Advisor for MNSHA, and we do a lot of work there. NISLA does a lot of work introducing students to opportunities and hosting webinars and things like that. A lot of the guests that I pull on here are people who are experts in their field, and they're talking at the graduate student level, telling them where their careers can go and what they can do. So I think those you're going to want to search out in addition to grad school.
Okay.
Very cool. I can ask the next question. I just kind of wanted to know, is it easy to change the area that you work in? So for example, going from a school SLP to a medical SLP, how difficult is it if you change your mind that you don't want to do something?
That's a good question. It is not that easy to change.
Okay.
Normally, once you get started on a career path, whether it's the academic or the medical setting, most clinicians tend to stay on that path. Because the medical setting, you have to cultivate a different set of skills that aren't reinforced in the school setting. And likewise, the school setting, you cultivate different skills that you don't have in the medical setting. I know Julie Horner was an interview I did earlier, and she had been in the schools for 12, 14 years and decided she wanted to go into the medical setting. And she took maybe a year and a half, 2 years of medical courses before she was feeling confident she could step into the medical setting.
Hey, that is good to know.
Mm-hmm. I do know also some school speech pathologists who will work PRN at a hospital, like over weekends as needed once a month. But working PRN in a medical setting or any setting is tough because you just don't get the exposure to keep your skills as strong as they need to be. In the medical setting, you're working with complicated medical patients. And it's not something you can just step in and do over the weekend once in a while.
I have the next question. So I was wondering what types of internships or opportunities that you felt that you would recommend in the summer between junior and senior year of undergrad when you're about to apply for grad schools. I know that Abby has I think she has an internship as a behavioral technician. I am a literacy teacher for a program called Reading Ranch. I was wondering if there was something more that we should do or any other areas that you think would be good to have on our resumes.
I think you're spot on with what you're doing. I've heard of other students taking some time and working at camps over the summer, but really anything that will give you more experience in the field that you're wanting to work in. So both of you are thinking peds and you're both working with peds. And that's neat. That's exactly what you want to be doing, is gathering that experience, working with the population you want to work with, and also networking and doing some interprofessional teamwork with other students in other professions. Sounds like you might have those opportunities at your settings. That's good.
Thank you.
Thank you. I just kind of wanted to know, within the SLP world, is it easy to advance or to get promotions, or is that something that you kind of need to get your PhD for?
Good question. Most of the time, there's two different, we all graduate with our master's degrees. Many people stay with their master's degrees and work in the school or the medical setting. If you want to advance, you can take some additional coursework and really begin to niche down into your specialty. Like one of my specialties is swallowing. So I've taken a lot of, very skilled swallowing courses and some voice courses. If you're in a rural setting, you will take those courses, but you may be the only speech pathologist in that rural setting. If you work in a big medical setting, like a university setting, you will complete competencies to advance your skill set, and then you can take on some of the harder, more complicated patients. Does that answer your question?
Yes. Thank you.
You do have to self-advocate for yourself. I had a student with me one time, and we were up talking with some doctors, and we told them what we were doing and why we were doing it, because we were, changing our diet levels from NDD to IDDSI. And on our way back to our charting area, I just popped my head in my director's office and said, "Hey, I just talked to these doctors and this went really well. You need to keep your skills, accomplishments, things that you do well. You have to keep them in front of your supervisor and let people know what you're doing. You're not bragging. You're just making sure that people know what you're doing and why you're doing it. And when it comes around to advancing, that's how you advance." One of the ways.
Okay. That's good advice. Thank you.
I was wondering, what is the most rewarding thing you feel is about being an SLP?
Medical or one with working with pediatrics? I can tell you both.
Yeah, both would be awesome.
My most rewarding medical SLP moments are in the swallowing world, when somebody is having some problems swallowing. And even when they come and they sit in for example, I'm thinking of somebody that I saw a while ago. They had come with their wife. He had come with his wife, and he had a progressive disease, and his swallowing was just getting worse, and he didn't want to let go of his oral intake. And he was getting to the point, though, where it was so hard for him to eat safely because he coughed and he choked and lots of troubles with water. So when we did the swallow study, we did the trials, and then I turned the camera around and showed him the videos that we had captured. And I said, when you swallow, this is where your food goes and this is where it doesn't go. and these are my recommendations for moving forward with you. And I seldom do it, but with that gentleman, when he swallowed, nothing went down. Multiple swallows. And his risk of aspiration was so high. He was currently a tube feeder, and he was wanting to eat again. And I said, this is why I would not recommend that you eat again. And he started to cry happy tears because I was able to give him the answers that he wanted to live the less struggle-free life that he had. And so I love it when I can answer questions for people and help them with their decisions that they have to make. With the little kiddos, oh my goodness, I feel like I've got these little children in my hands, and when I'm discharging, I'm just like, fly, little bird, because we've done so much good work, and these kiddos have just blossomed, and they meet their goals, and then they discharge. And I wish we could kind of, hey, who are you 20 years down the road? Do you remember your speech teacher? It's a very rewarding field to be able to help each individual person that I have the privilege to work with.
Thank you.
I think my last question for kind of just the general questions of this world is, could you tell us something about what your postgraduate, like immediately after you graduate from your master's degree, like your clinical fellowship year, what does that exactly entail, and what does it look like right after you graduate?
Your clinical fellowship year, if you're working, I think it's 32 to 40 hours a week, will be 9 months long in whatever setting you're choosing to go into. And you will have a clinical fellow supervisor, hopefully on premises where you are, but that doesn't always happen. You will step in and start resuming a caseload like a credentialed speech pathologist would. You'll work out your work hours in your setting, and your supervisor will, the first, 9 months long, typically, you're going to meet with your supervisor before you start, and you're going to go over what your goals are. ASHA has standards and things you have to meet every 3 months according to, hours, and there's a way you work through your clinical fellowship with your supervisor, and you start stepping into your careers, picking up the caseloads that you will see in that setting.
I have a follow-up question to that. So if you're working in a particular location for your fellowship year, is it typical for, if you're in an area, if you're working somewhere that it's really a good fit for you, and do they typically hire you right off the bat after your fellowship year?
Yes.
Okay.
Normally you start your clinical fellow and then it just continues on. And when you are done with your 9 months, it just extends. It just means that you're supervised during that time. One of the things that I've heard some clinical fellows say, that after their 9 months, they get a raise because they're no longer a clinical fellow. They've got their fully credentialed speech pathologists. And I've heard other ones say that after a year's mark, they get a raise. But there should not be a hiccup at all. After your clinical fellow is done, you and your supervisor will meet. And I always meet mine over a cup of coffee and a sandwich. That was pre-COVID. I don't have a clinical fellow now because I'm at a university. But and then we sign the papers off, and then the clinical fellows become credentials, and off they go into their careers.
Awesome.
You should have a very good working relationship with your supervisor. You should be able to reach out to him or her frequently, often, and you should be able to get a hold of them. They should be very accessible to you. For example, I've had clinical fellows where they've been at a nursing home, and I've been hired as a consultant by the nursing home contract company, and they can call me. Hey, what do I do about this? I'm having a problem with the patient here, or this or that. So when you guys are getting ready to do your clinical fellows, you're interviewing for that job, that's a good question to ask, is how accessible is the supervisor, my supervisor?
Well, I guess we can go into our questions about being a medical SLP or working in the medical setting. The first one that I had was, what type of cases would you see in like a hospital, but a pediatric hospital, since we're wanting to work in peds?
Sure. If it's an inpatient pediatric, you're going to see pediatric clients, patients that have typical pediatric disorders. You're going to be seeing them that have them, they're medically complicated though. So your feeding and swallowing incident or caseload is going to be much, 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 much higher. In an outpatient pediatric setting, your kiddos are going to be coming mostly for speech and language work.
Okay.
So the inpatient, you're going to be much more medically complex. You're going to be working with ventilators and medically complicated little kiddos. Outpatient setting, not as medically complicated. You will see speech, language, and some swallowing and feeding in the outpatient setting. ASD, pragmatics, the typical pediatric caseload that is covered in school is also covered in a pediatric outpatient setting.
Okay, thank you.
Mm-hmm.
My question for you, I guess you kind of touched on it a little bit with Jordan. I was just wondering if you could go into a little bit more detail of what are like all of the opportunities in the medical SLP world, as in kind of like what are the jobs and what do the jobs kind of entail? What will you be doing as a medical SLP?
Well, to anybody who's listening to this that is out in the field as a medical SLP and wants to jump on for a podcast interview, I'd say reach out to me, because my experience is just my experience. And there's medical SLPs out there who are really, really, really niched into the medical setting. For example, Dan Sherwood was episode 43, I believe, and he is a vocalogist, which is a voice specialist, and he works in a voice clinic. And a voice vocalogist would be considered, I guess, maybe a medical SLP, a voice. And so he works, you can have patients or speech pathologists who are specialized in, you can work in inpatient settings, outpatient settings, home health settings, which is where you go out to the patient's home. You can work in private practice settings. You can work in rural hospitals, rural clinics. You can work in downtown big city clinics. You can work through medical centers, big universities that have research teams, be part of a research team. I know you asked earlier about PhDs. Do you have to have your PhD? A lot of medical speech pathologists go on and get their doctorate of speech pathology, which is different from a PhD. PhD speech pathologists tend to go into the academic and research setting, and they do teaching and research. Speech pathologists who get their doctorates become more and more entrenched in the clinical providing setting, and they just become much more focused in their work. There's swallowing specialists who, in addition to being a medical speech pathologist, become very specialized in like fees and only do fees or only do mobile video fluoroscopies or mobile fees. It's just your profession can go anywhere you want it to go, anywhere around the world. There's people who practice, and I myself have practiced around the world. Not a lot, but it's a great field. Wide open.
What are the pros and cons of working in a hospital as an SLP?
The biggest con is you work. If it's a holiday, you might get it off. You might not get it off. You work 5 days a week if you're full time, or 4 days a week, and it's every year. You do get vacation and some main holidays off. The school setting speech pathologists get the summers off. That was always a big, I always wished I had the summers off, but I so love my medical SLP job It's just I got up and went to work. It's great. It's a great job. The pros, I think that's like the only con is you have to work weekends sometimes. If you're in a skilled nursing facility, you don't get holidays off. You work through, for example, if Christmas is on a Friday and you're scheduled to work on a Friday, you may be able to shift that Friday to a Saturday, but you have to cover those 5 days a week. So I guess the biggest con is the schedule. It's a very demanding schedule, and you go. If it's 52 below, like it was 2 years ago, I made arrangements to have my car plugged in, and I went and stayed overnight at the hospital so I could make sure I was there for my shift the next day. You just go unless you're sick. The biggest pro is I love the challenging work. I love every day is a puzzle for me. I walk in, the patients, it's a challenge for me to analyze and come up with a treatment plan and work with those patients, and they respond. So that's been the biggest reward for me, are those connections I make and the influence that I have in their medical journey.
That's awesome.
Very cool. My next question for you is, in the medical SLP world, is this something that you could do part-time easily? A lot of our professors talk about how at one point they started a family and they didn't want to work full-time. So they worked maybe 1 day a week so they could keep up their credentials. So that one day, when their kids are grown up, they could go back to it full-time. Is that something you can easily do in this world of speech path as well?
You can, if you're not in the super high technical demanding medical centers, I believe. Just because when you're seeing such critically ill patients, you really need that skill level that's developed, in my opinion. I hope I don't get people listening to this who are mad at me, but in my opinion, it just isn't something that you can do once in a while. So if you want to stay in the medical field, there are less demanding jobs as a medical speech pathologist, and by all means, continue with those. And it is good to keep your foot in the door and keep that skill level up where you can.
So what would some of the less demanding jobs be that you just mentioned?
Maybe a skilled nursing facility or home health, because there the patients aren't as medically complex. And they're not, you're not working with ventilators and things like that. But so it would be one of those less, it's still just as important. So I'm not saying that a home health speech pathologist, the skill level isn't as important. Just the setting is different, the demands are different.
Right.
So I have a kind of a two-part question. First, do you need special training to be a medical SLP? And if so, or just in general, do you choose your grad program that you want to go to? Are you looking for something that will say that there's more of a medical area? I know how we were talking about not specialties, but how we were talking about if we were interested in autism, looking for professors that work with people with autism. So are we supposed to look for something that's more medically based for the program?
Yes, you are going to have programs where your professors are definitely more into the neuroanatomy, like you were talking about with your neuroscience labs. So if you are wanting to go that route, then look for those programs that have those opportunities for you. There's different levels. I feel like from that previous question, there's different levels of in any field. You can have a general medical SLP who works with, some of your general medical SLP patients. And it's the same in the school. You can have a general school speech pathologist, and she works with general disorders. And in both the school and the medical setting, you can take your career as far as you want it to go. If you want to be really specialized in ASD and AAC systems or social systems, social pragmatics, then you take those courses you seek those opportunities and you advance your career in that direction. And the same with the medical SLP. If you want to be a general medical speech pathologist, that's fine, that's great, excellent. And because there's a very big need for general medical speech pathologists, and there are also needs for speech pathologists who have really niched down into the pediatric specialty world, like pediatric swallowing and ventilators. And those are the jobs that would be harder to do on a once in a while basis. Does that make sense?
Yes, thank you.
Mm-hmm.
Jordan, do you have any other questions for the medical SLP world? Because I think she answered all of mine for this section.
Yeah, I have one more. So when you're in a medical setting, do you choose your own workload, or does the hospital kind of like assign you your cases?
It depends on how big the setting is. If you're in a, like when I've worked at university hospitals, I arrive and I'm credentialed for certain types of patients. And I may be working with a team of maybe 7 or 8 other speech pathologists that day. And there are some who have passed the credentialing and all they do all day long is video swallow studies, or maybe fees or stroboscopies, or they have a variety of those specialty patients, and then some more of the more generalized patients up on the floor. If I'm working in a setting with a team of that many speech pathologists, it's going to depend on where I've credentialed into and pass those competency courses off, because those bigger hospitals, they have more testing and credentialing to pass you off onto some of those more challenging cases. If you are in a rural setting or an outpatient clinic, you may be the only speech pathologist. That means that everything that comes through that door is yours. So you're going to have to understand a lot of different etiologies and be able to handle basically what you need to do. The really complicated patients are going to be life flighted down to the bigger university centers or sent somewhere because they're more challenging. I have worked at some kind of rural hospitals, but they're still part of a main hospital system coming out of the cities. And there's been, for example, there's 3 of us, and one of them is a pediatric specialist for the outpatient clinic, but she does not do any inpatient care. And I am on the other side. I do a lot of the adults, and I do a great majority of the inpatient care, and I do all the videos. And then we have a third person who does she doesn't do any of the videos. She does some of the inpatient care, and she does some of the pediatric. So when you have a bigger team, people are going to complement one another. And your skill set may be here and somebody else's may be here. And more of those patients will go on, whoever schedule it's appropriate for them to go on to. If you're talking outpatient, then the schedulers are going to know who to send the different evals that come through. I'm going to take the adult neural evals that come, and the voice evals and the swallowing evals that come into our outpatient clinic. The pediatric specialist is going to take the peds that come to the clinic, unless there's, like, I've had the babies that come for the feeding, because I do swallowing, I'll see them. And then the third speech path on our team, she'll take what's appropriate for her. But we don't really get to choose. We choose when we pass our competency courses. For example, you're not going to be seeing a video swallow patient if you haven't had a course on how to do a video swallow study. Same with voice.
Gotcha. Thanks.
Sure.
Well, I think we now have our private practice questions, just a few left. We just kind of wanted to know, just an overview, what would it be like working in a private practice, and what does it all kind of entail, I guess, and the difference just between working in like a medical or in a hospital?
Private practice is different because you're the one that is making the decisions on when you start, when you stop working for the day. what type of patients you see and how long you see them for. You're also responsible for all the marketing and getting the referrals and doing all of the billing, making sure all of your documentation is being supported by, like if you have a Medicare patient, there's certain things that you have to certify. And so the bulk of that falls on you. In the medical setting, you show up for work, you pick up your caseload for the day, and you see your patients, and you make sure that your standards are met for charting and billing and everything else there, that everything is done by the end of the day, and then you go home. So private practice can be a lot more rewarding, but it's a lot more work, in my opinion. You have contracts that you are cultivating either with a hospital or with home health agencies, or you're on your own private practice and people are coming to see you. So different platform for working. But those who are, Jenna Castro-Caspon has a website called The Independent Clinician, and she's very successful. Lots of people doing private practice speech pathology right now.
So in a private practice, what are the majority of cases that you see in private practice, and how does that differ? I know you're going to see less swallowing case, or you're probably not as near as many swallowing cases. But what else is the difference between those?
It depends on what your specialty is. If you are a pediatric speech pathologist and that's your private practice, Speech of Cake is a very successful private practice, I think, out in California, and they see little kiddos, and that's all that they see. I'm trying to think of, there's another private practice, I don't remember her name, but all she does is fees, which is the swallowing studies. I know when I did my private practice, I saw adults in the home-based setting. And so I operated as kind of like my own home health, but it was private practice. So you really can decide. The private practice is just going to, you're still going to have the opportunities, not as many like in the hospital setting, because you're not going to be private practice in a hospital setting. So it's all outpatient based, but you're still covering the big nine. If you want to see fluency kiddos, and that's where your passion is, or maybe it's ASD, then your private practice is all about ASD. I know there's one private practice, I don't remember where they're from, but they're totally into AAC, which are the alternative communication devices. So the private practice speech paths that I know have taken their passion, they've stepped out of the clinical setting, and they've said, I'm going to start my own practice because this is what I want to do and who I want to do it with. Sarah, I don't remember her last name, On Your Voice is her private practice company, and she's a voice therapist. And she had been in the skilled nursing facility, and the demands for productivity were just becoming more and more and more unreasonable and frustrating for her because she couldn't give the quality of time. She didn't feel the support. She didn't have the resources or the materials. And her true passion was wanting to have her own voice clinic. So she prepared for about maybe a year, took a lot more specialized voice courses, and then I coached her through, and she became a private practice voice specialist. So you're going to find that your private practice speech pathologists are much more focused in one, maybe two areas.
Okay, thank you. Well, that was all of the questions that we had for you, Maddie. Thank you so much.
You're welcome. You made me think.
That's always good.
I've not had an interview like this before. Normally I do the interviewing, and I feel like you guys were interviewing me, but this is perfect. I'm so glad I got the opportunity to answer these questions.
Yeah, so we appreciated it a lot. You opened our eyes to a lot of questions that we had and all the opportunities that there are in this profession.
Good. Well, look back and listen back to some of the previous episodes on the Missing Link for SLP's podcast, because you're exactly the type of listener that I'm creating these podcasts for the speech pathologists who want to learn more about our field and what we can do. So if there's a specific interest you have, like I interviewed Bob McKinney on foreign accent reduction, which is something I didn't know it really existed years ago, and I don't think it did. So our field is just growing. If there's anything else you want me to talk about or anything else like that, let me know. And you guys want to come back on heading into grad school and do this again?
Oh, of course, that would be amazing.
Absolutely.
That would be fun. All right, we'll keep in touch.
Yes, definitely. Thank you so much. And I hope you have an amazing snow day.
Yes.
Yes, absolutely. You too, have fun in the snow.
Thank you.
I hope today's conversation has created some aha moments for you and motivated you to become a better SLP, continuing to connect some of those missing links between what you know and how to use that knowledge. Thank you for downloading the Missing Link for SLP's podcast. And if you enjoyed the show, I'd love you to subscribe, rate it, and leave a short review. Also, please share an episode with a friend. Together we can raise awareness and help more SLPs find and connect those missing links and get the information needed to help them feel confident in their patient care every step of the way. Follow me on Instagram and join the Fresh SLP community on Facebook. Show notes are always available, so come learn more at freshslp.com. Let's make those connections. You got this.